COVID-19, or coronavirus, is here. So it's important to have the correct information at hand, like knowing the symptoms: a high temperature, a cough, shortness of breath, or breathing difficulties. If you have symptoms, self-isolate to protect others and phone your GP. Visit hse.ie for updated factual information and advice, or give us a call. Protection from coronavirus. It's in our hands.
Nature has been researching your milk for hundreds of millions of years. The composition of your milk is alive and changes throughout the day, the night, the months, and the years to meet your child's needs. Your milk contains stem cells. These are cells that create and repair the body and are being researched worldwide to cure conditions like Alzheimer's and diabetes. Your milk contains components that kill cancerous cells. Your body identifies bacteria and viruses found in your baby's body and environment. You then produce antibodies specifically tailored to those infections and deliver them to your child through your milk. Your milk appears to switch on a gene in your baby's body, which produces a hormone called leptin. This hormone tells your baby when his tummy is full, protecting him against overeating. Your milk contains oxytocin, a hormone that induces relaxation and feelings of well-being in your child and in you. It's all in you. Human milk. tailor-made for tiny humans.
Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow-operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
Every year, thousands of children are affected by illness or injury, so knowing what to do is important, especially if you're a parent. When a child is sick or hurt, it can be a very frightening experience, but how you respond is vital. Basic first aid can often prevent the condition deteriorating or becoming life-threatening. The aim of these short videos is to give you the basic knowledge and skills to know what to do if your child is sick or injured. How you respond in an emergency situation could make the difference between life and death.
Gastroenteritis or tummy bugs are a very common problem for children. It's one of the commonest things that we see in the emergency department. Generally, it's a viral illness that is self-limiting and resolves itself without any treatment. But we want to tell you when to worry and when to come and seek medical help. Gastroenteritis, the children present with lots of frequent loose poos, sometimes associated with fever and sometimes associated with vomiting. But from your point of view, the most important thing to watch out for is whether the nappies are wet or not. If the nappies become dry, then the child is dehydrated and they need more support. Generally, the support that we give tends to just be oral fluids, which you can give at home as well. But sometimes we give intravenous fluids to help your child recover from this illness. Once your child has this illness, it's important not to spread it to other children, so hand washing at home and avoiding returning to the creche too soon is important so that the illness doesn't spread to other vulnerable children.
Most fits are not serious, but you may feel terrified watching it. Small children between the ages of 6 months to 6 years are prone to fits with a temperature, but most do not have epilepsy. At the start of an illness, as the temperature is rising, a fit can occur. Your child can turn blue, shake dramatically and froth at the mouth. Febrile fits are normally short and resolve by themselves in less than 5 minutes in most children. Any first fit needs an emergency phone call to get help. It is not likely to be serious, but you cannot be sure. First, you have to manage the fit with a little first aid. When a child has a fit, phone for emergency help, but also gently lie the child on his or her side on the floor in a safe place. Remove any nearby objects. Put nothing in the child's mouth. Note the details, what time the fit began and ended, and what does it look like. Check the temperature if you have a thermometer close by, but do not leave the child alone to do this. Most children like to sleep after a fit, and this is to be expected, so don't worry. Emergency help should be there soon. Years ago, people held down the tongue during a fit. Do not put anything in the mouth. It may make the child vomit, and that can be dangerous. When your child gets to hospital, the doctor will examine your child to look for the source of the temperature. The majority of these are simple viral illnesses which all children suffer from. Some children react to these by having a fit while others don't. It is likely that your child may be sent home and not kept in hospital, but it is important to get your child checked out.
Asthma is really common. About 1 in 4 kids wheeze at some point. It may be triggered by a viral cold-like illness or in some kids by allergies like pollen. The child may complain of feeling unwell, or you might simply notice that they are breathless when talking. You may also notice that they've stopped running or playing because they are short of breath. Look for signs of increased work of breathing, like a faster rate, visible indrawing of the wall of the abdomen just under the ribs, or increased movement of the neck muscles just above the collarbones. You may hear noisy breathing, such as a whistling sound or other abnormal sounds. Any child with asthma should have an action plan. This is a set of instructions for what to do if wheezing starts. This should include using an inhaler, usually this blue one, through a special plastic device called a spacer. A spacer is simply a kind of plastic bottle or box. The inhaler is attached to one end and the child's mouth to the other. Younger children may require a spacer with a face mask attachment, as this will ensure a good seal. It's really important to use this spacer. It makes it much easier as the spacer holds the medicine in the chamber while the child inhales. To use correctly, shake it, remove the cap and attach it as shown. Then gently hold the mask against the face, or the child may put its mouth around the other end of the spacer. Press to release a puff of medicine and watch the child take 4 breaths. You can observe the valve move with each breath the child takes. The action plan will usually say how many puffs of medicine to give, 4 or 6 perhaps. Then wait a few minutes. If they are no better, repeat. If still no better, seek medical attention as a matter of urgency.
Accidents happen, and this is especially so for children. A broken bone is a common injury in a child, especially after a fall. No matter what part might be broken, or how big or small the injury may seem, all broken bones need medical attention. Your child's bone may be broken if you've heard a snap or a crack during the injury, if there is swelling or bruising or tenderness, if they are in a lot of pain, or they are unable to move the injured limb. It's important to keep the injured limb as still as possible. This can be done securing the limb to the body with a scarf or towel, or by resting it on a pillow or cushion. Keep your child calm and comfortable by giving them some pain relief, and seek medical attention at your nearest hospital as soon as possible.
Road-related injuries are the #1 cause of death and serious injury in children. To reduce this, make sure your child is in a correctly fitted car seat or child restraint for every trip. This needs to be age appropriate. Reduce your speed to under 30 kilometers per hour when driving in residential areas, and ensure that your child wears a bicycle helmet when cycling, on a scooter or a skateboard. Beware of driveway backovers, and always watch out for young children when reversing your car. To avoid drowning accidents, make sure your child wears a life jacket if they're in a boat, and teach them how to swim at an early age. Never leave a child alone in a bath, even for a minute. Be especially wary of ponds and pools if small toddlers are around. To avoid burns and scalds, always use child-resistant cigarette lighters and never smoke around young children. Have a working smoke alarm in your home and make sure you check it regularly. Beware of hot drinks. Put the milk in first when making tea or coffee to reduce the temperature. Preset the temperature for hot water in baths, and never leave an iron or curling iron plugged in or within reach of children. To avoid falls, avoid baby walkers completely. Use stair gates to prevent young children falling down the stairs, and window guards to avoid first and second floor falls. To prevent choking, avoid latex balloons. Also avoid drawstrings on children's clothes and pull cords on window blinds. Young children have a tendency to put everything in their mouths, so be vigilant at all times, especially if they're playing with toys that have small parts such as Lego, or if there are foods about like peanuts or popcorn. To reduce the risk of poisoning, keep medicines out of reach or in child-resistant containers or blister packs. Be wary of household chemicals, button batteries and detergents, and make sure they are safely stored away.
Croup is a condition that causes swelling to the voice box and the windpipe, resulting in a harsh barking cough and hoarse musical sound called stridor. Stridor is usually more pronounced on breathing in, but can be heard on both breathing in and out. Croup is usually caused by a viral infection and affects children between the ages of 6 months and 5 years. Viral croup may start as a runny nose and a low-grade fever. The noisy breathing and barking cough frequently present overnight. A child with stridor does need a medical review by their GP or in the emergency department. The treatment for croup is usually steroids in liquid form. If the child has stridor when they are resting, then they do need medical observation until this resolves. More severe cases can require nebulized therapy. Croup can rarely be life-threatening, and in such cases a breathing tube is required to make the child's airway safe. In rare cases, other more serious conditions can mimic croup. Therefore, it is important to get your child seen if they have stridor.
In Ireland, constipation affects 1 in every 3 children. In 95% of cases, there is no known reason for it. This is known as idiopathic constipation. If your child is passing hard, dry stools with difficulty, less than 3 times a week, they may be constipated. If they are also having frequent accents, they may have impacted stools and are experiencing overflow diarrhea. This can be viewed by some as bad behaviour, but in fact the child has no control over this. If constipation is left untreated, it can lead to anal tears, which cause the child pain and in turn lead to holding onto the stool. There are some key points to remember. Know the different types of stool to identify constipation with or without overflow diarrhea. Type 3 and 4 are normal stools, Type 1 is constipated, and Type 7 with Type 1 is constipation with overflow diarrhea. Impacted stool must be cleared out with higher doses of laxatives as prescribed by your doctor. After this clear out, maintenance medication must be taken to prevent a build-up of stool. A common misconception is that laxatives may make the bowel lazy. This is not true. Keep a diary for a week and look at how much fluid and fibre they are consuming. A typical 4-year-old needs over a litre of fluid and 9 grams of fibre a day. Your child should be sitting comfortably on the toilet with an insert and footstool if needed. Feet together with knees level with the belly button and elbows resting on the knees. Gentle pushing down can help the stool out. Blowing bubbles and balloons can cause enough pressure instead of going red in the face. Encourage your child to move around. Exercise of any kind is better than sitting in front of the telly. It will really help the bowels to move. Children that experience hard stools that are sore to pass will often hide in the corner and avoid the toilet. Keeping the stool soft will help, and eventually the child will forget the pain. But this will take time. Early detection of constipation is a must. Treatment takes time and effort. Talk to your GP about any concerns that you have.
Every day, children accidentally injure their mouths and teeth. Injuries can be as simple as bumps and scrapes, or as dramatic as knocking out a tooth altogether. Knocking out an adult tooth is a real emergency, and here's what you need to know and do. The tooth will have the best chance of survival if it is replaced quickly. This is ideally done within a few minutes. To do this, hold the tooth by the crown, not by the root. Clean it under running water and push it back in its socket. You shouldn't touch the root, as the cells covering the root are very delicate. Once the tooth is back in place, bite down on some clean fabric or tissue and go to the dentist straight away. If you can't get the tooth back in, put it in milk and get to the dentist immediately. Try to call the dentist on the way to let them know to expect you. Never replace a baby tooth that's been knocked out. If in doubt, put the tooth in cold milk and get to the dentist immediately. As a guide, it's useful to know that most children don't have any adult teeth until 6 years of age. For most other dental injuries, like fractures and minor displacements, there's no immediate first aid required, but you should give your child pain relief if they need it and call your dentist to arrange to see them as soon as possible. Baby teeth and adult teeth that have been dislodged a little can usually be gently pushed back into place by your dentist and are sometimes held in place with a splint or brace. Broken teeth can be fixed with a filling material, and if the inner layers of the tooth are exposed and sensitive, treatment can be carried out to keep the tooth healthy. Seeing your dentist within 24 hours is usually fine for these kinds of injuries. Cuts and scrapes to the lips and gums are quite common. Bleeding is usually controlled by applying pressure with a clean piece of damp fabric or tissue for 5 minutes. Make sure your child wears a mouthguard and an appropriate helmet for sports such as hurling, camogie, rugby and boxing, and a helmet for activities such as cycling, skating and scooting. Custom fitted mouthguards offer the best comfort, fit and protection. Frequent dental visits from an early age provide you with the opportunity to discuss oral health issues that are important for your child. Most people don't know that dentists recommend that you bring your child for their first visit by their first birthday. It's always good to start early to get the best advice possible.
Sunburn is caused by overexposure to the sun, and children are especially vulnerable to the sun's strong rays. Sunburn can be avoided by wearing a hat and long protective clothing and by applying a high ultraviolet protection sunscreen on exposed areas. If you think your child has been sunburned, look for 3 things: reddening of the skin, pain in the area that has been exposed, and blisters. If your child is under 1 year of age, seek medical attention immediately, even if the sunburn appears mild, as infants can dehydrate quickly. If your child is older than a year, remove them from the sun immediately. Cool the area down by sponging them with a cool, clean washcloth, or soak the area in a bath or shower for no longer than 10 minutes. This can be repeated a few times during the day. Encourage your children to drink plenty of fluids to keep hydrated and give extra fluids for 2 to 3 days. If the skin doesn't blister, then the sunburn may be mild and can usually be treated with calamine lotion or an after sun cream, which will soothe the sore skin. When going outside, all sunburnt areas should be completely covered to protect the skin until it's fully healed. Clothing should be loose so the burnt area is not irritated. If blisters appear, the burn is more severe and you will need to see a doctor. You should also seek medical attention if the sunburn covers a large area, your child has fever or chills, your child has a headache, confusion or feels faint, or you see signs of dehydration.
Liquid tabs are an effective detergent when used properly in the washing machine, but as such they contain potentially dangerous chemicals. When children get their hands on the brightly coloured pods, the consequences can be serious. Since the contents of the pods differ between manufacturer, the effects can vary. Once in hand, the pods can easily burst and leak liquid onto the skin. This can cause problems like rash, pain and burns. If a pod bursts onto the skin, it is important to first remove the pod from the child's hand and wash the liquid off thoroughly with cold water. We would always advise going to see a doctor for further assessment after you wash the skin. If a child then puts his hands to his face, the liquid may cause serious damage to the structure of the eye, resulting in pain, distress and infection. The pod should be removed and all exposed surfaces washed with water, including the face and eye area as well as they can tolerate. Any child with liquid tab contents in the eye needs to go to the hospital for review. We need to do a complete assessment of the eye and then wash it out with a lot of water to reduce the risk of further damage. If a child bites into or swallows a liquid tab, the contents may cause very serious effects like burns to the digestive system or breathing difficulties. All these cases need to be brought for assessment to a doctor or emergency.
When you and I get a cold, we tend to have a stuffy nose, we might have a temperature and we might have a slight cough. It gets better in a few days. If a small baby gets a cold, it can go down onto their chest and we call this bronchiolitis. So they start with the stuffy nose and the runny nose and then they develop a cough that seems to last sometimes forever, but generally it gets worse for about the first 3 or 4 days. The next 3 or 4 days are when you feel really worried because your baby doesn't seem to be getting better, but that's a normal pattern. And then after that, the baby gets better slowly, though sometimes the cough can be there for up to about 4 weeks. It's usually caused by a virus, so no antibiotic or medicine will help you get better faster. We usually recommend is that you just mind your baby, not too much handling, feed them little amounts and often, and they will get better by themselves. Some babies do need to come into hospital or do need a doctor. Key things to look out for are if you're just worried about your baby, if they're pale, if they look grey, if they look blue or tired or sweaty, if they're not really interested in their surroundings as much as they normally are, if their breathing is very fast or if they're having episodes where maybe they're even stopping breathing, or if you notice that they haven't had a wet nappy in a while. If you're worried about any of these things, just pop into your doctor or bring them to your local hospital.
Anaphylaxis is a severe and potentially life-threatening allergic reaction. The most common causes for anaphylaxis in childhood are foods, the most common foods being peanuts and shellfish, but also rarely common foods such as milk or egg. If you're having an allergic reaction, it might be mild or moderate. This would involve a rash, some facial swelling, possibly vomiting. If this is all that's happening, then what's needed is the administration of antihistamine and to keep a close eye on the child that the reaction doesn't progress. A reaction that progresses to involve shortness of breath or difficulty in breathing or circulatory collapse such as fainting, this is indicative of anaphylaxis. The treatment for anaphylaxis is adrenaline. The adrenaline pen should be given as an intramuscular injection to the upper outer thigh. It should be injected into the thigh, held in place for 10 seconds, removed, and then the skin around there massaged for 10 seconds. If you're not sure that the features they're having are typical of anaphylaxis, but you suspect because of difficulty in breathing or circulatory collapse this may be happening, then it is much safer to give adrenaline. Adrenaline is well tolerated by children, and it is very unusual that it would do any harm to a child. If you have previously been considered at risk of anaphylaxis by your doctor, you should have been prescribed adrenaline, and it should have been demonstrated to you by the doctor or by the pharmacist. Once adrenaline has been given, other medications, if not already administered, can also be given, such as antihistamines or asthma medications such as Ventolin. If after 5 minutes the child still remains symptomatic with shortness of breath or circulatory collapse, a second adrenaline pen can be administered in the same way as the first. However, if the child has improved significantly, then no further treatment is required until emergency services arrive. If you are having anaphylaxis and you do not have access to adrenaline, then it is important that you phone 999 and state the words anaphylaxis. Lie the child flat or get them into the most comfortable position they can manage, and if you have antihistamines available and they have not already been given, these can be administered. Otherwise, it is a case of waiting for emergency services to arrive who will carry adrenaline with them. It's important after adrenaline has been given or after anaphylaxis that urgent medical attention is seen. Even if adrenaline has been given and there has been a significant improvement, children must go to hospital.
We sincerely hope that you will never be faced with this scenario, but this skill is an easy and effective tool that may potentially save an infant's life. If your child is choking, he may appear distressed. He may have a silent cough or cry. His face will be pale and his lips may be blue. If this happens, supporting your baby's head and neck with his head lower than the level of his chest, in between his shoulder blades with the heel of your hand, you need to hit him hard 5 times. Don't worry about hurting your baby. You need to relieve this obstruction. Generally, back blows are enough to relieve the obstruction, but if your baby is still not breathing, you need to do 5 chest thrusts. This is done by using your 2 fingers in between the nipples, the lower half of his breastbone, going on an inward and upward motion to your baby's head. 1, 2, 3, 4, 5. You're going to continue doing chest thrusts and back blows until the object comes out or your baby goes unresponsive. If your baby goes unresponsive, you need to follow the guidelines for infant CPR. If you see the object in your baby's mouth and it is easy to remove it. However, never put your finger blindly into your baby's mouth, as you could push the object further back or you could injure the inside of their mouth, causing more problems. If your child has had a choking episode, they need to be followed up by a doctor.
Burns in children make up a significant proportion of our emergency department attendances. The majority of burns we see are caused by scalds from hot liquids and affect infants and toddlers. This is often due to their quick, unpredictable movements. We also see contact burns from heated appliances such as hair straighteners and irons. If your infant or child has sustained a burn or scald to the eyes, nose, mouth or neck, you must seek medical attention from your nearest emergency department immediately, as their vision or breathing might be compromised. If other areas are affected, you must still plan to seek medical attention, but in these cases it's safe to take a few minutes to apply some first aid measures at home. The first step is to cool the affected area under cold running water for at least 15 to 20 minutes. You may use a tap or a shower. This may be distressing for small children, but it is the most important measure to prevent further ongoing heat damage under the skin. The water temperature does not have to be freezing. 15 degrees Celsius is ideal, and remember to never use ice on a burn. The second step is to take off any wet or burnt clothing. If a piece of your child's clothes appears to be stuck to their skin, do not peel it away. Leave it in place and cut away the clothing around it. Many parents apply household products such as butter and grease to burns and scalds. We do not recommend applying anything to the burnt area until it has been seen by a medical practitioner. Greasy substances will only keep the heat in and slow down the healing process. Skin that has been burnt will often form blisters. If this occurs, do not pop the blisters at home, as this is your body's way of preventing a skin infection. Remember, burnt skin is extremely painful, so please give your child some pain relief as soon after the burn as possible. There is no medical reason to cover a fresh burn. However, if the burnt area is at risk of rubbing against objects or sun exposure on your way to the GP or emergency department, you may want to loosely wrap a clean, light cloth like a muslin or gauze around your child's burn. Do not apply anything tight to the area. The burns we see are almost always preventable. When minding small children, never leave hot drinks or dishes uncovered. Always keep heated appliances such as hair straighteners, kettles and irons out of reach. Never leave a mobile child unattended. Never leave a baby in the care of their young sibling with no adult supervision, and always check your child's bath water temperature with a thermometer before placing your child in it. This information is intended for first aid only. Always seek medical advice for burns and scalds, no matter how minor they seem.
Happily, meningitis is much less common than before due to vaccination, but it is always wise to be on the alert for it. Watch out for a fever with a developing rash, which does not fade when you press against it, a high-pitched cry, and marked pallor. These are features of meningococcal infection and need medical attention immediately. Also beware of the child who has had chickenpox for the past 3 days and who then develops a second wave of temperature and a spreading red rash or reddened areas around the chickenpox spots. It may be that the chickenpox spots have become infected, but you need to be on your guard for a bug called strep A. This is a very nasty bug that can sweep through the system. If you suspect this, seek medical attention immediately.
Head injury is one of the most common presentations to an emergency department, and the vast majority of kids are diagnosed with minor head injury. There is often a bump or a bruise on the exterior of the head, and other symptoms may include nausea or feeling sick, mild headache, tender bruising, mild swelling of the scalp or mild dizziness. If your child experiences these mild symptoms after a knock, a bump or a blow to the head, you do not require any specific treatment. Observe them closely for 48 hours and monitor whether their symptoms improve or worsen. The serious symptoms to know about are unconsciousness, either very briefly or for a longer period of time, difficulty staying awake or being sleepy several hours after the injury, having a seizure or a fit, difficulty speaking such as slurred speech, vision problems or double vision, difficulty understanding what people say, reading or writing problems, balance problems or difficulty walking, loss of power in part of the body such as weakness of an arm or a leg, pins and needles in the hands or the feet, memory loss such as not being able to remember what happened before or after the injury, clear fluids leaking from the nose or ears since the injury, a black eye with no other damage around the eye, bleeding from one or both ears, new deafness, a loss of hearing in one or both ears, bruising behind one or both ears, or a lasting, strong, persistent headache since the injury, vomiting since the injury, irritability or unusual behavior, visible damage to the head such as open, bleeding wound. If any of these symptoms are present, particularly the loss of consciousness, even for a short period of time, immediately go to the emergency department of your local hospital or call 999 or 112 and ask for an ambulance.
For parents, one of the most frightening things that can happen is that their baby stops breathing. Follow these simple steps to administer CPR. Gently stimulate the baby by tapping the foot or squeezing the hand. Shout for help if there's no response, but remain with the baby. Gently tilt the head into the neutral position to open the airway. Have a quick look in the mouth to see if there is anything visible. If there is, lift it out. With the head in this position, check for breathing. Look for a rise and fall in the chest and tummy. Listen for breath sounds. Feel for air from the baby's mouth on your cheek, taking no longer than 10 seconds. If your baby's not breathing, give 5 rescue breaths by blowing gently into the lungs, covering the baby's nose and mouth, ensuring there is good seal and you can see the chest rising. Each breath you give should be approximately 1 second in duration. If there are no signs of life, example eyes opening or limb movement, the baby's heart may not be beating properly and you must begin compressions on the chest. Place the tips of 2 fingers on the lower half of the breastbone and push the chest down gently but firmly to a depth of 4 centimeters. Push fast for a count of 30. Then give 2 breaths, followed by 30 compressions. Continue this sequence for 1 full minute. After this, if you are still on your own, make a call to the ambulance stating your emergency. Return quickly to the baby and begin with compressions, alternating breaths as seen, until the baby responds, or you can hand over to the ambulance.
Most poisonings we see in the emergency department occur in toddlers. Common substances are medicines and household cleaning agents. Most children with accidental poisoning do fine, but many substances have potential for very serious consequences. The commonest medicines ingested would be liquid paracetamol or ibuprofen. Most parents don't realise how dangerous paracetamol can be. Children may also take medicines which belong to an adult family member. A single tablet of some of these can be fatal to a toddler. For example, certain blood pressure medications, antidepressants, or tablets for diabetes. Other common but dangerous medicines include iron supplements and aspirin. Household cleaning agents are often quite corrosive. A very small amount can cause burns to the mouth and throat, resulting in pain and damage. Antifreeze for cars contains an extremely toxic alcohol. A very small quantity is poisonous. If you find a child with medicine or household agents, stay calm. Remove the poison from the child. Wash any visible product off the skin with plenty of water, including the eyes. Do not give a drink unless advised to do so. Never force the child to vomit. Call poisons information. If the child collapses or has a difficulty breathing, call an ambulance. Go to the emergency department and bring the medicine or solution with you. Usually, when a child accidentally drinks the poison, it's because someone has transferred it into a water or soft drink bottle. That's why cleaning products or weed killers should never be decanted from their original packaging.
It is likely that nearly all children will need to take medicine at some point during childhood, and we know from talking to parents that this can be a worry at times. As well as providing you with the medicine your child may need, your local pharmacist is always available to help with any queries or concerns you may have in relation to your child's health. If you find it difficult to read and understand prescriptions or instructions, don't be afraid to ask us for help. Your pharmacist can easily explain them to you. Every pharmacy has a private consultation room, which you are more than welcome to use if you would feel more comfortable speaking in private. It is so important that you read the instructions carefully. No matter how well you think you know your child's medicine, check what it is for, and how to use it. It can be a good idea to keep a log to record doses given. This can help when multiple people are giving your child medicine throughout the day. It is important to use a correct measuring device, for example an oral syringe or measuring cup or spoon, to ensure you are giving an accurate dose to your child. Avoid teaspoons as these can vary widely. Remember, when medicine is not taken properly, it can cause more harm than good. And for this reason, we always need to ensure that we keep medicines out of reach and sight of children. Some medicines may need to be stored in the fridge and out of direct sunlight. Again, make sure your little one won't be able to get to the medicines themselves. Read the storage instructions or ask your pharmacist if you are unsure. Also, if you need to take medicines yourself, don't take them in front of children as they often copy what they see adults doing. Medicines can interact with other medicines, vitamins and even food, so make sure you let your doctor or pharmacist know if your child is taking any other medicines. This will help you to use the medicine safely and will help avoid taking things that don't mix well together. Do not use any medicine past its expiry date, as it may not work as well and may be harmful. Don't destroy or throw out unused or out-of-date medicines yourself. Return them to your pharmacist who can destroy them safely. Please feel free to visit your local pharmacist for further advice and support. We are here to help.
Vaccines are a simple, safe and effective way of protecting children from serious infectious diseases. Before vaccines were introduced, diseases like polio, measles, TB, diphtheria and whooping cough caused serious ongoing health conditions and killed hundreds of children. Today, because of vaccines, it is extremely rare to die from these diseases in Ireland. Vaccines work by triggering our immune system to fight certain diseases. If a vaccinated person comes in contact with these diseases, their immune system is able to respond more effectively, either by preventing disease or reducing its severity. Getting your child vaccinated helps protect others in your community, like your neighbour who has cancer and cannot get certain vaccines, or your friend's newborn baby who is too young to be fully immunised. When everyone in a community who can get vaccinated does get vaccinated, it prevents the spread of disease and can slow or stop an outbreak. Routine vaccines protect against 14 childhood diseases, including whooping cough, measles, German measles, meningitis and pneumonia. 2 vaccines also protect against cancer, the HPV vaccine and the hepatitis B vaccine. The recommended vaccine schedule is designed to protect infants and children early in life when they are most vulnerable. Their immune systems are not yet fully mature, making it easier for bacteria and viruses to multiply. Booster vaccines are given when children start primary and secondary school, as they are exposed to more children and therefore to more infections. Childhood immunisations are recommended at 2, 4 and 6 months, 12 and 13 months, 4 to 5 years and 12 to 13 years. These vaccines are available free of charge for all children. To be fully immunised, children need all doses of all vaccines in the recommended schedule. If your child doesn't receive the full number of doses, they're vulnerable to serious diseases. You can obtain the latest schedule information by talking to your doctor or online at immunisation.ie. Vaccines are very safe. However, like all medications, vaccines may have side effects. While your child may experience some discomfort or tenderness at the injection site, this is minor compared to the serious complications that can result from the diseases that these vaccines prevent. A slight reaction actually shows that the vaccine is having the desired effect on the immune system. A child may also get a mild temperature, be out of sorts and off his or her food as a result of the vaccine, but these generally get better themselves in a day or two with cuddling. Serious side effects from vaccines are very rare. If you have any concerns about vaccine safety, mention them to your doctor. Your child should not be vaccinated if they have a fever over 38.5 degrees. Check with your doctor if your child has ever had an allergic reaction or is undergoing treatment such as cancer treatment, which suppresses their immune system. Keep a record of your child's vaccinations. To find out more about immunisation, go to www.immunisation.ie.